Here we have the hip bone. The hip bone is actually 3 bones in one. You have the top part of the hip, which is called the ilium. Then on the bottom, you have the back posterior part, which is thicker. That is the ischium. And then you have the anterior front part, which is called the pubis, or pubic bone. So we can situate this just like this. Okay, the weird bumpy surface of the ilium should be towards the back. That's what's going to articulate to the sacrum. The hole should be facing towards the bottom of the bone and a little bit more front like this. You can kind of see how we have this little bowl shape here of what will be the hip. So this is a right hip. Now on the ilium here, the whole entire top line of the ilium, that is called the iliac crest. The frontmost point here of the iliac crest is called the anterior superior spine. This cup created on the inner side of the ilium is the iliac fossa, while the whole wing itself is referred to as the ala. The surface here, where the sacrum is going to articulate and attach, that's called the auricular surface. And here at the base of the auricular surface, we see this big indented area, which is called the greater sciatic notch. As we follow that down, we get to the ischial spine, coming off of the ischium, which is going to help create our lesser sciatic notch. So again, we have this indent here, which is the iliac fossa, the top ridge, the iliac crest, top front point, anterior superior spine, auricular surface, and the whole wing is referred to as the ala. Here you can see the lateral side of the bone. We have our greater sciatic notch, ischial spine coming off of our ischium, and the lesser sciatic notch. The whole is called the obturator foramen. There's an obturator nerve which goes through here. And then on the lateral side here, we can see this nice big cup indent. That is for the head of the femur. This is what the head of the femur is going to look like. That's going to go right into that pocket there. That's called the acetabulum. So the head of the femur into the acetabulum. That is going to create the hip socket. So if we were to actually look at this from the back side here, this is what it would look like if somebody was sitting down. So when you sit, you place your weight on the ischium of the hip bone there, and you can see the head of the femur going into that acetabulum. You can also see again the sciatic notches from the posterior here, as well as that ischial spine.